So I will be doing a simple wound dressing change using a sterile no-touch technique. So when coming into the patient, introduce yourself, check the patient's tag and for the patient's name and birthday. Also explain the procedure to the patient, provide privacy, ask the patient if she might need some analgesia before the procedure or if not. And so now I'm going to expose the patient to your hand hygiene, and then wear clean gloves because you'll never know if the wound is still, if the dressing is still intact, and if maybe it's already oozy or dirty. So you have to wear your clean gloves when you assess the wound. Only expose the wound and cover the patient. And then now that you see the area, you can assess the surroundings, check the area around if there's any redness, swelling, or if the skin is dry. And now that it's okay, you can take off the gloves and discard it. Do your hand hygiene again, and gather your supplies. So for this, we're gonna use the dressing tray. Always check what's inside so you will know what additional supplies that you'll be needing. And get your cleansing solution, and if you need additional gauze, and your tape. So I'm going to open the dressing tray now using a sterile technique. Okay, there's a forceps inside. So with this forceps, you can get the underpad. Make sure you keep the rest of the kit sterile, and you can just drop this off on the patient. Also the waste bag. So now you can prepare your dressing tray. You can take out each. You can separate it first so it will be easier or later when you going to wet it. Okay, and also your dressing. Okay, now that this forceps is non-sterile, I can put it aside, making sure that the tip is still inside the sterile area. Now I can pour the cleansing solution inside, just enough. And I can now do my hand hygiene again, and wear another pair of clean gloves. I can put my waste bin far away from my sterile field. And also put the drape over the patient. With my clean gloves, I can take out the dressing slowly. Also check the patient, the reaction, if it's painful. Just take it off slowly. And then I can now assess the inside of the dressing, if there's any discharge, the color, if there's any odor, and how soaked the dressing is. So now I can throw this away on my rubbish bag. Also, I can also use the forceps to take out if there's any packing or extra gauze inside, and then I'll discard the forceps. And also my my gloves. Can also assess the wound, if if it's getting healed. Also, if there's any sutures, if it's still intact, and the appearance of the wound overall. So I can do my hand hygiene again and wear my clean gloves again. So with using my two forceps, careful not to touch the tip of the forceps. Okay. Now I'm gonna moisten my gauze. And then I'm gonna wipe the wound first from the incision side. So one stroke, and then I'm gonna discard it. And then I'm gonna use another gauze. Moisten it again. Make sure that it's not dripping wet. And then I'm gonna wipe the outer edges. Then I'm gonna throw and use another one for the bottom part. Okay, so make sure that it's all cleaned up. If not, you can just repeat. Okay, make sure that your left forceps is kept sterile. And then now with the remaining dry gauze, I'm gonna wipe it dry. Same thing from the incision site first. One stroke for each gauze, and then the edges. Now that it's dried up, I can put one gauze on top. Keeping it sterile, the inside. And then I can now take off my clean gloves and put the tape on top, making sure that the edges are sealed. can discard all my my drips and my kit into the rubbish bin, and do my hand hygiene. Also, keep the patient comfortable, adjust the bed to its to the lowest position again, and record the documentation, the dressing change, and whatever assessment that you have found on the patient while doing the dressing change.